Let's talk about female longevity and the difference between lifespan and health span. So my algorithm is serving me a lot of what I call wellness bro information, really awesome podcast and things where they're discussing longevity. And this is a space that is really exploding and a lot of great information there. But what I want most people to understand about this data and information is most of it was not done on females. Even in the labs, most of the animal models were male. And especially in this longevity, lifespan, health span space, it's really a mistake to assume that we are small men with breasts and uteruses. Let me tell you a secret. Females are winning the longevity race by far. The average woman lives 4 to 6 years longer than the average man. But here's the difference. Our health spans are terrible. We are living 20% of our lives in poorer health than our male counterparts. The burden of disease is much higher for us. And the path to this begins when we go through the ovarian failure that is menopause. When we lose the ovary's ability to produce our sex hormones, multiple organ systems begin to struggle in our bodies. Nothing is left off the table. Our brains, our bones, our hearts, our lungs, our kidneys, our gut, our skin. Can you live healthily without the benefit of hormone replacement therapy? Yes, but it's harder. So in my clinic with my patients, we talk about health span. We know she's going to live longer than her husband in general, but she's much more likely to be burdened with chronic disease in the form of dementia and frailty. She's much more likely, like 3 to 4 times more likely, to end up needing a long-term healthcare facility. Actually, if she makes it past the age of 85, the risk of her ending up in a nursing home is 50%. That is what she wants to avoid. She's not looking at red light therapy or cold plunges or saunas to improve her lifespan. She's trying to stay out of a nursing home. So what I do is focus on what we know will improve her health span. And it is lots and lots of different things. I focus on the studies that were done in females that actually showed improvement in their quality of life and health span throughout time. And we talk about frailty. So here's a study. Association between menopause hormone therapy and frailty. And what this particular study found was that treatment duration of more than 2 years and up to 5, and age at first treatment between 50 and 59, and MHT initiation 3 to 6 years after menopause, timing is critical here, were all negatively associated with frailty. I talk to my patients about trying to build a better body that is going to support them for these last 30 to 40 years of their lives after menopause. And any discussion around that without being very clear and intentional about your nutrition, especially protein intake, fiber intake, vitamin D intake, any discussion around exercise that does not include resistance training, stimulating the musculoskeletal unit, is a mistake. We talk about supplementation. We talk about community, friendships, stress levels, sleep optimization. All of that is critical to the female health span. HRT is not mandatory, but it is an important tool in your toolkit if your goal is to live as healthy as possible with our biologically determined greater lifespan.